Hi, everyone. I'm Maggie McGrath, editor of ForbesWomen. Throughout this week, the Trump administration had released an executive action that appeared to put a moratorium on spending on federal assistance programs, putting in question people's ability to access Medicaid services. On Wednesday, the administration issued a memo putting a moratorium on the earlier memo, but nonetheless, companies that have customers and patients that use Medicaid have had quite a whiplash of a week. So, one of those founders of one of those companies joins us now to talk about her experience. She is Anu Sharma. She is the founder and CEO of Millie, a tech enabled midwife company. Anu, thank you so much for being here.
Thank you for having me.
So I just outlined what has been a bit of a back and forth week in terms of executive actions and litigation and moratorium and the like. You have a company where 20% of your patients use Medicaid. So can you just give us a sense of what it's been like for you and your patients this week?
Yes, it's been a wild week, to put it mildly. And the tricky thing that people don't realize about Medicaid and maternity is that 42% of births in the US are actually paid for by Medicaid. So it's actually a very significant payer. And also, when you look at, where these patients often tend to be, they tend to be in parts of the country where access to care is otherwise not available. And so when you cut access to Medicaid or Medicaid expansion or Medicaid services, you are quite literally taking away care for a very large percentage of this population. And so we were sitting here not entirely sure, what to expect as the week went on, because we do here in California, which is our most populous state, and, 1 in 7 or 8 babies in the country are actually born here. And we do see a fairly significant Medicaid population. We were not sure, what to expect in terms of continuing services. Now, obviously, we would not take any immediate actions, and we will continue to provide care to our patients until the situation is resolved. But we do have other patients that we do take care of and, are probably a little bit less impacted by actions like this compared to, for example, the federally qualified health centers or FQHCs or hospitals that have substantially Medicaid-based populations. Their entire funding source could potentially be put in jeopardy, and they care for some of the most vulnerable people within their patient populations at an extremely vulnerable time. And so it's really helpful when there is a little bit of advance warning if significant changes like this are about to be announced, so that people can take stock of what that might mean and create appropriate transition plans for patients and inform both patients and their providers in terms of what to expect. And so we hope that this revocation will remain in place, and that if there are any further changes, they will be thoughtfully announced with enough time to prepare.
In the event there is further executive orders or even congressional action that affects Medicaid funding, can you talk about first what you see as the hit to your patients, the Medicaid patients, if that were to happen? What would be the ramifications on their lives and ability to access care?
Yes, I think the most immediate impact would be we don't know if they're continuing to be covered by insurance, because we don't really know what shape or form this might take. So if it is, we're freezing any further payments to Medicaid plans, then it sort of begs the question, okay, like which Medicaid plans are our patients on? Or is their coverage about to be immediately impacted? Is this a future action? So we would have a lot of questions to the state Medicaid agencies, both Medi-Cal as well as the Medicaid MCO plans that administer these plans for the state of California here in our market. So it would sort of, we would take off on a series of phone calls to get just immediate clarification in terms of who is and isn't covered. And in the meanwhile, we would look to keep our operations level. All of our patients would continue to get care because that's what we would do just as providers who are responsible for the care for these patients and their families. And we wouldn't really change anything as such, but it would put a lot of things, kind of under a microscope in terms of, kind of what are we anticipating our patient population to look like, and what is our need in terms of provider staffing and coverage, and what do we need to be aware of in terms of, coordinating their payments with other agencies, because it's not just one thing. There's Medicaid actually pays for, kind of office visits and labor and delivery. But, when it comes to labs and radiology and non-invasive prenatal testing, that is Quest or another radiology center. So it doesn't just affect us, it affects the entire ecosystem of partners that we work with to take care of these patients. And so that's what it would really kind of create in terms of, chaos for us operationally as well as in terms of financially, but also a lot of confusion for our patients, who would not know if we're still in network for them or not. And I'm not sure that the Medicaid agencies or the MCO plans would really have answers for them because I think they'd be looking to the federal government to provide direction. So yeah, they have significant ripple effects when things like this kind of come out because people are mid-care and oftentimes in a vulnerable state. They could be in labor and delivery, or they could have just given birth, or they could be newly, kind of starting their prenatal care. And so, they could be at any point in this journey. They may have experienced a miscarriage, or they may be, kind of experiencing some post-birth complications. It's just there's a lot that goes on in pregnancy.
The human body does not pay attention to the congressional calendar, I guess is just put it. What is your message? Because, of course, that was a hypothetical question, but what is your message to either California lawmakers or national lawmakers or to the presidential administration itself as someone running a company in maternity care dealing with a Medicaid population? Is there anything that you would tell our elected officials at this point in time right now?
I would just say, please don't do this. Plain and simple. I mean, these are, it's half the country. 42% of the patient population, as I mentioned, tends to be Medicaid beneficiaries in terms of, births, and it's an obligation, that the federal government has, for patient care and safety towards them, and so. If we're going to do anything at all, and especially for mothers and babies, I think a lot more care, thought, and intention is required to do that in a way that does not disrupt care at a very, very vulnerable time. And, it's sort of, also, a lot has been said within the Trump administration around, wanting to boost birth rates in the US and expanding coverage for IVF and fertility. And so I think it puts a lot of uncertainty on families, as they think about family building and plans. And so I think we want to be consistent. It's not just, we're freezing funding for Medicaid. We're sending a message to families across America.
Now, whenever I speak to a founder CEO in a sector that could be affected by government spending or a presidential administration, no matter when there is a transition from one president to another, it is a transition. It is a moment of uncertainty. So, what are the concrete steps you have found yourself taking in recent weeks and months to buttress your business? Are you calling investors and or philanthropists to make sure there's some extra money on hand if you need, or for other founders who might work in either maternity care or healthcare at writ large, what are some actionable things you are doing that they could also do?
Yeah, I mean, I think the most important thing, we're raising a round of capital to expand our offerings and our markets. And so the first thing investors want to know is that their money is actually going to be safe in terms of the use it's going to be put to, which basically means we have to be very thoughtful about, the offerings that we choose and the markets that we choose to kind of expand into. So we spend a lot of time, it's really thinking about market selection, very thoughtfully. We think about demographics, we think about where there are access gaps and where the need is. We think about the reimbursement landscape, both commercial as well as for Medicaid. We think about health system partners, and we think about the availability of clinical talent. See, all of these are things that kind of go into the equation. And so, when there is uncertainty in the macro environment, around, is there going to be a significant change to the payer landscape, or, to the Medicaid coverage, it can significantly impact our plans in terms of which markets we're choosing or not choosing. And when there's uncertainty around women's health, which there's always uncertainty around women's health, that also really puts into question, how we sort of, navigate, the decisions that we're making in terms of the offerings that we have, And so another fact, just in numerical terms, 20 to 30% of pregnancies will result in a loss, and 80% of the time that will happen in the first trimester. That is just how pregnancy goes. And so the uncertainty around, kind of coverage for, what quote unquote is called abortion care isn't that straightforward. These are not always elective decisions that people are making. They may be experiencing a miscarriage. And so, it's really helpful, I think in the maternity care landscape and the women's health landscape more broadly to have consistency of direction, so the providers know what they can and can't do and where they can do what and not, because otherwise it really creates a lot of confusion on the front lines during very difficult times in people's lives and for very vulnerable populations. And so yeah, I mean, that's kind of how it really impacts us and how it impacts our ability to continue to do what we're trying to do and the difference we're trying to make in the world.
And one of the differences you're trying to make in the world, it could really help change the statistics around maternal mortality in the US, which of course is has one of the worst rates of maternal mortality in the developed world. So Anu, if we could just zoom back a little bit for folks who might not be familiar with your story, I'd love for you to spend just 30 seconds reminding everyone why you founded Millie and exactly what you're trying to do.
Yeah, I mean, I come from a family of physicians and worked in healthcare for about 20 years. I've done a lot of things over the course of my career. I've worked with most of the large national plans, many of the regional blue plans, many health systems, and a lot of my work, has been shaped during the years that led up to the Affordable Care Act and then kind of on the other side of it. I worked through the public exchanges. I worked on new payment models, just a lot of, different facets of care. And and then I went through my own family building journey, which involved 6 rounds of failed fertility treatments, ultimately a natural pregnancy. And then as I moved through the maternity experience, I really sort of saw the whole journey through the lens of a patient, going through the a healthcare system. And it's a pretty one-dimensional model, which is focused on providing minimal clinical care, at episodic points along the journey to make sure you and the baby are okay. But as a patient, if you've never been through pregnancy before, a lot of questions. You have needs around emotional support, lactation, nutrition, mental health, relationship counseling, learning what it means to give birth, learning how to take care of a newborn, learning how to breastfeed. And none of that really is part of the healthcare model, within maternity. It's all things that you piece together and pay for, often out of pocket. And so, the patient experience is certainly broken, but and it's not the easiest journey that people make, as they transition into parenthood. But in my case, it went a step further. I saw how broken the care model itself was, and I had a near miss with postpartum preeclampsia 5 days after my daughter was born, and quite literally 36 hours after I'd been discharged from the hospital, which I actually self-diagnosed and ended up going back to the hospital on the verge of a stroke and saved my own life. And so I saw up close, just the failures of the care model in the current form, in that we really don't provide kind of continuing care between visits and just really leave it to people to kind of identify when things go sideways and to get care in a timely way. And it's a pretty fragmented experience and just leaves a lot of gaps. And so that's really what we're trying to solve at Millie, just building a better model that is really kind of knitting all the pieces together to create smoother transitions into parenthood and better experiences through care, but also with an eye towards more proactive care and a better job, really managing care between visits, and especially in the more vulnerable moments, when things can often go sideways and patients are, often still in recovery or figuring out life with a newborn or establishing breastfeeding and are often not paying attention to themselves. And so that's what we're creating in the world, and we are excited to be ready to expand to more markets this year.
I'm sure you can't tell us which markets yet, but we started this conversation talking about political challenges to your business. I want to end by asking about the opportunities that you see, kind of on the subject of market expansion. What are a few specific areas you are most excited about and look forward to in terms of Millie's growth?
Yeah, I mean, I'm a huge optimist. I think it's sometimes people ask me, "You worked in healthcare such a long time. It's such a complicated industry. Everything moves so slowly. How can you possibly be optimistic?" And it's because most of my career has been really about creating change in healthcare, and I believe it's possible. And I'm especially excited about creating change at this moment in time in this space. And 51% of the country is women. the healthcare industry was really not built around their needs. I think they are more aware of the gaps and they are seeking out better models. And so I think there's a lot of opportunity to kind of provide better care and better experiences to a population that is large and ready and looking for better solutions on the one hand. And I think on the other hand, we have significant national OBGYN shortages. And so we do need models of care that incorporate more collaborative approaches that include midwives and others kind of working in concert to really kind of more fully leverage the limited OBGYN capacity that we have to bring care to more places. And so I'm excited to be building a model that really centers midwives. It's sort of, what our peer nations do, whether you look at Canada, the UK, elsewhere. And so I'm excited to be kind of, really bringing that model to the US in a way that's more mainstream. And I'm really excited to be able to do this work from a place where we, kind of are succeeding at what we're doing and are clearly seeing patients wanting more and, being in a position to expand.
Anu Sharma, founder and CEO of Millie, thank you so much for joining us. We really appreciate your time and insight, and you will have to come back when you are able to share exactly where you're expanding and how you're growing.
Yeah, I'm looking forward to that.